Welcome, Oskaloosa. I'm here with General Surgeon Tim Breon, and you're with Mahaska Health, and we're going to talk a little bit about coronavirus today. So, kind of tell me how Mahaska Health is ready for this, and kind of what you guys are doing to help keep the community protected.
Yeah, well, I think there's a lot of discussion about what the coronavirus is, and I think most people now probably know that coronavirus isn't a new thing. We have several coronaviruses that cause the common cold. There have been 4 or 5 or 6 different coronaviruses, but the one that people are concerned about started in China, and so that coronavirus is a new novel virus. It was actually renamed today by the CDC COVID-19. COVID meaning coronavirus disease 19. So as not to make animals or people feel bad, they just give it a bland name. But it has been renamed today. But coronavirus, COVID-19, is a virus that is currently mostly in the country of China. Most of the diagnosed cases have been in China. Actually, only 390 or so cases outside of China, and only 1 death outside of China. But there have been over 1,000 confirmed deaths in China alone. So it's really a big concern for people in China. And so it's really mostly a concern for us if anybody from this area has traveled to China or come back from China. So obviously locally, our doctors are asking those questions, and we have people come in with questions, and they want to make sure that they don't have any big risks that would put them at a person that would be something we would call a person under investigation.
And I don't have the virus, so.
No,
but
I hope not.
I hope not, yeah.
You're within my 3 foot.
Yes. All right. I mean, he has a good sense of humor as well. So we do have, some local companies that do business in China. And so I'm sure for those reasons, you guys have really been trying to stay on top of what's going on in the latest developments.
That's right. And I think there aren't any confirmed cases in Iowa, and so people are concerned that this is going to be something that will be a problem for Iowa. We don't know what the future holds, obviously, and the World Health Organization is taking this very seriously because, this is something that it's in its infancy, and we're hoping that it will be under control. They think there's a vaccine that will be available for it within 18 months, but still there's a lot of time in the next 18 months for that to progress. And so this is similar to the SARS virus in 2003 and the MERS virus in 2012. And this has surpassed the deaths from the SARS virus, which everybody was aware of in Hong Kong, which started in China, and the MERS virus, which started in Saudi Arabia. And so, the biggest thing that we can do is try to track where our patients have been to and come from, and who have they been exposed to that could potentially put them at a risk where they would need to be investigated. So if we have somebody that comes here that's traveled outside of the country, even in China, or been with people that have been in China, and they have fever and shortness of breath and cough, then we might be concerned enough to put them in as a person of concern, and we might then make sure we have to get some testing done. And so to get testing done, what we currently do is we contact the Iowa Department of Public Health. And we can contact them 24 hours a day, and then we would get specimens from those patients if they felt that they were concerning enough that we needed to submit their specimens. And then they would be channeled through the Iowa Department of Public Health to the Centers for Disease Control, the CDC, where the testing is currently done.
All right, and really your chance of getting the flu and dying from the flu here in Iowa is far greater than coronavirus at this
That's
point.
right. No confirmed cases in Iowa of the coronavirus, the COVID-19, the novel virus, but we've had 18 deaths from the flu so far since September of last fall in our own state. So many cases of the flu, most commonly influenza B.
So some symptoms, we have, like I say, family members that are near to others that have traveled. Mm-hmm. Maybe some symptoms maybe unique to the virus that maybe folks should be aware of, or is it resemble more of a flu cold kind of deal?
Yeah, it's mostly a respiratory virus, even though it does have some GI symptoms with those cases in China. The biggest things would be fever and shortness of breath and cough. And so if you have those and you've been with somebody that's traveled outside the country to China, or you've traveled to China, those would be the main concerns. Once again, it does have some gastrointestinal symptoms, but those are less concerning less significant or less consistent than the respiratory ones alone.
Have I missed anything, Doc, while we're talking about this that would be of importance to our listeners and readers?
No, and I think it just it puts people in a position where you have to remember how important it is to protect yourself and to protect those around you from being exposed to any virus, for that matter. Mm-hmm. I think some big things. It is a virus, so it's an illness that will someday respond to a vaccine when we identify a vaccine against that specific genotype of virus. It isn't treated with antibiotics, but sometimes your doctor may have a concern about your virus and may still use antibiotics because they're concerned about a co-infection with a bacteria that could be treated with antibiotics. So, the biggest things would be hand washing. Don't cough, cover your mouth with your arm or try to cough into something where you're not coughing into the air.
And stay back that 3 foot.
Stay back more than 3 foot. That's 3 foot's the kind of the safe distance that we like to talk about. And then make sure that you wash your hands after you have touched any. The concern is that viruses may be transferred from animals to humans, and so, like I said, the SARS virus came from a civet cat. The MERS virus came from camels. They don't know what the exact animal vector was for the COVID-19, but they know there's lots of markets in China where they are exposed to lots of animals and even meat products. And so they're encouraging people to make sure you're not eating raw or undercooked meat. And so make sure you're cooking well. Make sure you wash your hands before cooking. Make sure you wash your hands after cooking. And make sure that you're keeping yourself clean and doing all you can to use just the stuff that we already know about, trying to prevent yourself from getting an illness. This is an illness that we think travels in the air by air droplets, so just like most colds and bugs do, so just be careful.
All right. And
I'm sorry.
He's a busy man.
CDC. Oh.
Well, I'm glad that you were able to help give us a little advice before they gave you a call and called you up. So thank you, Doctor.
Thank you. I appreciate it.
You bet.